Good day. I would like to welcome you to Climate Change Health and Emergency Care in Africa, a workshop for climate change and health advocates at the 5th African Conference on Emergency Medicine, the first ever climate change and human health workshop. We are so excited to have you with us today. Despite not being able to meet in person, we are excited that we are able to partner with the organizers and work together in order to make this happen, for us to still collaborate on complex issues like climate change and human health, for us to collaborate and come up with solutions that improve the health of our patients and the members in our communities. We're so excited to hear about your experiences and engage with you during our workshops today. We have no disclosures, and we are really excited to share an amazing lineup of talented experts with you. We hope you enjoy the day. If there are any questions, please reach out to conference planners or advisors. We are also available via the app. We would especially like to thank the African Conference on Emergency Medicine conference organizers and planners for their leadership during this trying time. We also hope this finds you and your loved ones healthy. We know it's not easy. And so we come together today to partner and advocate for health. Now, you are no strangers to the headlines that we've seen over the last year. All of our communities have experienced extreme weather events. We've experienced record warming temperatures. We experienced wildfires, water scarcity, dust storms, floods, tropical cyclones. We've learned about members in our communities who were displaced, lost their homes. We've heard about the health harms of these events from our patients who come to us asking for help. Now, the headlines are clear, but what does the science say? That's what we're going to delve into today. We're not only going to look into the climate science, most up-to-date research, but we're going to explore education and advocacy. We're going to answer the question, what can we do as health professionals to improve the health of our patients and communities when it comes to climate change, extreme weather events? Today's hosts, I'm Dr. Caitlin Rubley. I'm an emergency medicine physician at the Medical College of Wisconsin. I'm joined by two of my collaborators and co-presenters, Dr. Emily Cavallo-Hines, Global Health Lead at the University of Colorado School of Medicine, expert in global health, having worked in austere environments around the world. I'm also joined by Dr. Corey Bills. He's the Global Health Fellowship Director at the University of Colorado School of Medicine. Again, he will share his expertise in working in many different settings. We are emergency medicine physicians. We welcome you as health professionals, researchers, advocates for human health when it comes to addressing the health impacts of a changing climate. Now, the goal for today is to develop a climate lens. Not for me, but for you. I want you to maximize the use of the resources that are being put in front of you today. I want you to seek out the interests and passions that you have so that you can walk away with a better understanding and direction of what defines climate action for you. Now, we all work in different settings. One solution for me won't be the same solution that your community may need. But together, we can brainstorm. None of us has the solution to curing the health impacts of a changing climate. But we do have solutions And we can better recognize the harms that are being inflicted upon members in our community. And so I ask you to have an open mind and remember, this is your day. This is your network. And we're here to be hypothesis generating, to give you ideas on how to engage in advocacy, in education, and right at the bedside with patients. Now, why are we here? Why? We're all busy. There are a myriad of other places we could be right now. But why did you show up? So I want you to take a moment, bring out your pen or paper, your computer or phone. I want you to draw a triangle. Draw a triangle and write down 3 reasons why you are a climate change advocate, why you want to be a climate champion in your institution or community. 3 reasons. I'll do it with you. I'll give you a little clue as well. Perhaps it'll be the people or for people. Perhaps you'll think of places that you want to protect. Or maybe it's the knowledge you want to gain. All right, do you have something down? I'll share a few of mine. So when it comes to people, I think about the next generation of physicians, the children growing up today. I think of how different their practice may be compared with ours. For places, I think of my hospital. This picture was from relatively recently. There was a heavy downpour when I pulled into work. I looked up at the roof and it was leaking. I thought about what if I couldn't get to work or if the parking structure broke down. Thirdly, I think about the questions I still have and want to answer that will help patients. Just last week, I was working a shift and I looked at the inhaler. I took a picture for you. And it says, if you can't read it, it says store at 25 degrees Celsius or 77 degrees Fahrenheit. Now, with the warming temperatures, what happens to the efficacy of that medication? And what does it mean for healthcare utilization for patients? Now, I'm sure you came up with many other reasons to be here. And I just want you to remember why we do this work and why it's important. Now, the layout for today will be broken down into 3 different sessions. Session 1 is climate, health impacts, and emergency care. Session 2 is climate smart healthcare, making things work in your context. And the 3rd and final session is empowering action, translation to providers. Each session will be approximately 2 hours long. The end of the session will conclude with a live workshop and discussion of about 30 minutes. There will be breaks in between each session. You are encouraged to use the app or the chat to engage as we go along. Session 1 is Climate, Health Impacts, and Emergency Care. I'll provide a brief welcome and introduction, and then we'll share our keynote address by Dr. Jonathan Patz. Next, we'll have video interviews with the African Federation for Emergency Medicine stakeholders. We'll have a review on climate change and policy, just the basics we'll call it. Each session will have a just the basics session. Next will be top ways that climate will change your clinical practice. And lastly, we'll have a live group discussion. Our objectives for session 1, state acute and chronic climate stressors, improve your own understanding of exposure pathways when it comes to climate change, and health impacts as they pertain to emergency care practice. Third, recognize opportunities for health professional involvement in acute care settings. Many of you have probably seen this chart. It depicts the warming land and ocean surface temperatures that we're seeing. Climate scientists tell us that we're having record-breaking temperatures. And these are impacting people. Now, this next image is from a New England Journal of Medicine article by Dr. Andy Haynes and Professor Chris Eby. I really like it. At the top, you can see increasing levels of carbon dioxide and short-lived climate pollutants, essentially rising greenhouse gas emissions. They're driving rising temperatures, further contributing to rising sea levels and fueling extreme weather events. There are various demographic, socioeconomic, environmental, and other factors that influence the magnitude and pattern of risks. And then there are various exposure pathways of which health outcomes result. Exposure pathways depicted here are extreme weather events, heat stress directly, air quality, water quality and quantity, food supply and safety, vector distribution and ecology, as well as social factors. For examples of health outcomes, you can see there, emergency medicine touches just about every section. There are injuries and fatalities, mental health impacts, or direct heat-related illnesses, and heat stroke causing death. Air quality is leading to exacerbation of asthma and other respiratory diseases, allergies, as well as cardiovascular diseases and cancers. Water quality is impacting diarrheal illnesses, especially for children. Infections like cholera, cryptosporidiosis, leptospirosis. Food supply is being threatened. Undernutrition and malnutrition, food poisoning. Vectors are changing. Mosquito and tick-borne illnesses are expanding. There's dengue, encephalitis, Rift Valley fever, West Nile virus, including neuroinvasive diseases, and Zika virus. And then, of course, there are many social factors that play into the physical and mental health effects related to these issues. If we look at them a little closer, again, increased levels of carbon dioxide driving rising temperatures, various factors that influence magnitude and pattern of risks, and then various exposure pathways and health outcomes. This is just another way to depict what I just said, the impact of climate change on human health. You can see, again, increasing carbon dioxide, rising temperatures, more extreme weather events, sea level rises, contributing to a myriad of health impacts. Think about the patients that you see and what health outcomes have resulted that you have treated. This image is from the United States Global Change Research Program. Essentially goes through the different climate drivers, exposure pathways, health impacts, and health outcomes. You can see how exposures and sensitivities result potentially in different health impacts and outcomes. Things like education, poverty, occupation, racial discrimination matter. All of our communities have different vulnerabilities when it comes to climate change.